The code of silence in the ER, as a you mean as the employees, everybody knows that the employee is abusing a substance. Well, normally we try to avoid confronting the individual. Whenever we think that an employee is impaired, the first thing we do is we try to bring it up to the attention of one of the supervisors, and we prevent that individual from taking care of a patient. So we try to take that individual to a more controlled type of area, and then from there the supervisor normally contact HR, and there's specific steps that the hospital has to follow in order to assure that not only the patients are not being cared for by that impaired nurse, but that nurse is receiving care him or herself also at the same time. But we normally don't have a confrontation with that nurse. We try to make it seamless. Like if I see that you're impaired and you're about to give a medication to a patient, or if you're about to start an IV or do any type of procedures, I would normally ask you to go ahead and speak to you outside the room. I'll bring you into, like, let's say, the staff lounge, and in a non-confrontational manner, we let them know, look, you something is off with you today. Let's say I'm gonna go ahead and talk to the supervisor so she can have a word with you, just until we figure this out, okay? But for the patient safety, we're moving you to the side. And normally it's done by the charge nurse, and that is brought up by one of the staff members, And there's certain things that you see with employees when they're impaired, and things such as coming very early to their shift or leaving very late, or if you see a pattern in their patients receiving frequent medication for pain and not having pain control, those are normally indications that something is off. Wearing long sleeve always, those are things that we normally look out for. Acting differently than the baseline, but sometimes they're difficult to identify. Okay. One of the reasons I feel that you would delay reporting a coworker is going to be because you're going to have a conflict of duties. You have the duty of working together with your colleagues, and sometimes the nurses feel that if they report their colleague, they're going to lose the job, or it may affect their ability to retain a nursing license. But I think the main issue that nurses have in reporting is that they lack the ability to identify an impaired worker and identify those subtle changes that they take, they go through when they're impaired, or when they're diverting narcotics, which is the typical term that they use in the hospital setting or in the chronic setting, is diversion of narcotics. And looking at those very specific subtle changes or subtle things that the nurses do when they're diverting, if you don't know them, you won't be able to identify the problem. So I think that's probably the main reason why there's a delay. In our ER, we do biannual clinical fairs, and one of the topics that they do is normally substance abuse, because we do have a substance abuse treatment program within the hospital, and a lot of the patients, in order to get through that to that program, they have to come through the ER. In regards of staff, they do awareness about those very specific things that I was telling you that we look out for, and whenever we see them, we normally bring it up to the attention of either the supervisor or the charge nurse for steps to be taken, just to monitor those nurses a little bit closer for the safety of both the nurse and the patients who they're caring for. Definitely, especially since I've seen very, very good nurses go down that route of diversion of narcotics or negative coping. It doesn't have to be necessarily narcotics, like alcohol abuse and things like that. And I feel that, given that most nurses go into the profession trying to help people, not necessarily thinking that they're gonna end up abusing some of the medications that are using to heal the patients, they deserve a chance to reheal themselves. I mean, we do it with patients who have diabetes and heart problems. Why not with patients who have substance abuse? No difference. I think combination of both. To a certain extent, there has to be a disciplinary action within the rehabilitation of the individual, um, especially when individuals are repeat offenders, and they've been through the rehabilitation several times, and there's no way for them to um, there has to be something that makes the experience negative for you to decrease a certain behavior, and that's like basic type of behavioral intervention. You know, if only pleasure comes from something, you're gonna have a repeat of the same type of behavior. And uh, if we make it negative, or if we make let's say a noxious stimulus, or if we punish in a way, you know, and punishment is normally not indicated as a first line of defense, and even within behavioral therapy. But whenever we think that either the individual or the patient is in danger, there has to be a type of behavioral intervention that yields a faster result. And normally punishment is that type of behavioral intervention. Um, but I do believe that like nurses should not be fired if they're found diverting narcotics. Other way around, they should be given the opportunity to rehabilitate and go through, you know, a process in order to heal themselves. Definitely. Okay, so very little punitive, more rehabilitation. Well, nurses, you know, and this is, I'm not even sure this is coming from any type of uh, research study or anything like that. I'm not quoting anyone. I'm just telling you this from personal experience. A lot of the nurses rationalize their use to narcotics, saying that, you know, they know that it's something that is negatively influencing their life, but at the moment they need it, or this is just a temporary fix, or you know, they try to cope other ways with their current negative life situations, and now this is, you know, how they're getting through the period. A lot of times they rationalize it that way. Other times they'll tell, you know, they'll tell the managers, I'm able to stop whenever I can, or they think they have that belief that they really can stop whenever they want, when in reality they're depending on the medication in order to function. Like sometimes I've seen nurses that have to take the drug in order to function as a nurse, otherwise they will be completely dysfunctional. And this is when they actually get dinged. They, you know, you see a staff member acting completely different, and then we realize that this is a patient, a nurse who has been diverting narcotics for a long time, and now since they weren't able to obtain them today, they're acting completely different. That's how they raised that red flag within the hospital. I think it's within their rights to keep it private. They don't. I don't think they disclose it to the staff members. I think this remains within HR and the human resources department, and also within the management department. They keep that information in. A lot of times, what they'll do is they'll limit their access to narcotics. They'll give them the possibility of taking care of patients, but not have access to the area of the patients that has narcotics, or they would have to have a second nurse witness there with them, you know, their withdrawal of narcotics and things like that. So, and I believe there is a stigma with any type of psychiatric or mental health issue. There's always a lot of stigma within the community, and that's why nurses should be not only aware that it exists, but also that it's a disease process like any other type of psychiatric problem, you know, and very difficult to overcome by whoever is experiencing it.